Welcome to the Home Health Training Part 1. My name is Teresa Rada, and I'll be presenting Section O, Special Treatments, Procedures, and Programs. I am a physical therapist with experience in direct patient care, education, and administration. My experience includes inpatient, outpatient rehabilitation, home health, and hospice settings. Currently, I'm an associate at Apt Associates in Cambridge, Massachusetts. At the conclusion of this training, you should be able to identify the item organization and the new standardized data item added to the Outcome and Assessment Information Set, or OASIS-E, in Section O. You'll be able to describe the intent, the data sources, and the coding instructions for the new Section O item. Here is an overview of Section O in OASIS-E. The existing OASIS items included in Section O are M1041 Influenza Vaccine Collection Period, M1046 Influenza Vaccine Received, and M2200 Therapy Need, which is no longer collected at the follow-up time point. The OASIS items removed are M1051 pneumococcal vaccine and M1056 reason pneumococcal vaccine not received. The new assessment item in Section O is O0110, Special Treatments, Procedures, and Programs. This item has been added to the assessment instruments across post-acute care settings. Now, let's take a closer look at this new item, O0110, Special Treatments, Procedures, and Programs. Here is the intent and rationale for this item. The intent is to identify any special treatments, procedures, and programs that apply to the patient. And the rationale is that any of those listed can have a profound effect on an individual's health status, their self-image, their dignity, and certainly quality of life. Here is a screenshot of the item. This assessment item is collected at start of care, resumption of care, and again at discharge from agency. For discharge, there is a column labeled C at discharge, which is hidden in this screenshot. The data sources for this item include reviewing the patient's clinical record, consulting patient, family, caregivers, or other staff, determine whether or not any of the treatments, procedures, or programs apply during the time period under consideration for the start of care, resumption of care assessment, and during the time period under consideration for the discharge assessment. The instructions are the same for each assessment time point. Check all treatments, programs, and procedures that apply and are part of the patient's current care or treatment plan, performed by others, the patient independently, or after setup by agency staff or family or caregivers. Performed in the patient's home or in another setting, such as a dialysis center. Check if the patient is undergoing treatment at the time of assessment. A1 would be for chemotherapy, B1 for radiation, and J1 for dialysis. Do not check services provided solely in conjunction with a surgical procedure or diagnostic procedure, such as IV medications. Surgical procedures include routine pre- and post-op procedures. These next couple of slides have some chemotherapy-specific coding instructions. We begin with the coding instructions for chemotherapy. O0110A1 is for chemotherapy. You would check this for any type of chemotherapy medication administered as an anti-neoplastic for cancer treatment given by any route. And then the item breaks down into more specifics. O0110A2 would be for IV chemotherapy, that which is administered intravenously. O0110A3 is for oral chemotherapy. So this would be for chemotherapy administered by pills, capsules, liquids, or anything that the patient swallows. It also applies if the chemotherapy is administered through a feeding tube or percutaneous endoscopic gastrostomy, PEG. Other category would be used if the chemotherapy was given in a way other than intravenously or orally. For example, intramuscularly, intraventricular, intrathecal, intraperitoneal, or topical routes. Next, we have O0110B1 radiation. Check if radiation is administered intermittently or via a radiation implant. Moving on, we have oxygen therapy. So O0110C1 is checked if continuous or intermittent oxygen is used via a mask, cannula, including bilevel positive airway pressure, continuous positive airway pressure, and however, this item would not be used for hyperbaric oxygen for wound therapy. The item is further broken down into O0110C2, which is for continuous oxygen. This is for oxygen therapy that is continuously delivered for greater than or equal to 14 hours a day. O0110C3 is for intermittent oxygen use. This is for oxygen therapy that's used intermittently or not delivered continuously for at least 14 hours a day. And then the final element under oxygen therapy is high concentration, which is O0110C4. A high concentration oxygen delivery system is one that delivers oxygen at a concentration that exceeds a fraction of inspired oxygen of 40%. It can include high or low flow, and devices may also include invasive mechanical ventilators, non-invasive mechanical ventilators, and tracheostomy masks if the delivered fraction of inspired oxygen of these systems exceeds 40%. O0110D1 is used for suctioning. You only code tracheal or nasopharyngeal suctioning in this item. If the patient performs their own tracheal or nasopharyngeal suctioning, this item may also be checked. Do not include oral suctioning here. Suctioning is further broken down into O0110D2 scheduled and O0110D3 as needed. Scheduled suctioning is performed when the patient is assessed to clinically benefit from regular interventions, such as every hour. Scheduled suctioning applies to medical orders for performing suctioning at specific intervals and/or implementation of agency-based clinical standards or protocols and guidelines. As needed is performed on an as-needed basis as opposed to regularly scheduled intervals. For instance, when secretions become so prominent that gurgling or choking is noted, or a sudden desaturation occurs from a mucus plug. Moving on, we have tracheostomy care, which is O0110E1. You would check this if cleansing of the tracheostomy or cannula is performed. This item may also be checked if the patient performs their own tracheostomy care or receives assistance. For item O0110F1, invasive mechanical ventilator or respirator, This particular item would be checked if any type of electrically or pneumatically powered closed system mechanical ventilator support is used that ensures adequate ventilation in the patient who is or may become, such as during weaning attempts, unable to support their own respiration. O0110G1, non-invasive mechanical ventilator. This is for the BiPAP CPAP mask device, which enables an individual to support their own spontaneous respiration. You would check this if any type of respiratory support device is used that prevents airways from closing by delivering slightly pressurized air through a mask or other device continuously or via electronic cycling throughout the breathing cycle. This item may be checked if the patient places or removes their own BiPAP or CPAP mask or device, or if the family or caregiver applies it to the patient. You would check G2 BiPAP or G3 CPAP as appropriate. Then we have O0110H1 IV medications. And this includes any medication or biological that is given via IV push, epidural pump, or drip through a central or peripheral port. Epidural, intrathecal, and baclofen pumps are used as they are similar to IV medications, involve the continuous administration of a substance, and must be monitored frequently. You do not include flushes to keep an IV access port patent or IV fluids without medication. Subcutaneous pumps or IV medications administered during dialysis or chemotherapy would not be included, and dextrose 50% or lactated ringers given IV are not considered medications. Here are a few more coding instructions for H1 IV medications. You would use H2 vasoactive medications when at least one of the IV medications has a vasoactive effect. H3 antibiotics when at least one of the IV medications is an antibiotic. And H4 anticoagulation when at least one of the IV medications is an IV anticoagulant. You would not include the sub-Q administration of anticoagulant medications such as sub-Q heparin. You would check H10 other if at least one of the IV medications was not an IV vasoactive medication, IV antibiotic, or IV anticoagulant. These might include IV analgesics, morphine perhaps, or IV diuretics such as furosemide. Moving on, we have O0110I, which is transfusions. Here you would code transfusions of blood or any blood products. However, as we mentioned in many of the other items, you would not code any transfusions that were administered during dialysis or chemotherapy. For J1 dialysis, you would code peritoneal or renal dialysis, which occurs in the home or at a facility, or if the patient performs their own dialysis. You would check J2 for hemodialysis and J3 for peritoneal dialysis, depending on which is appropriate. IVs, IV medication, and blood transfusions administered during dialysis are considered part of the dialysis procedure and are not coded under items K0520A, parenteral IV feeding, or under O0110H1 IV medications, or O0110I1 transfusions. Now we have O0110O1, which is IV access. You would check this if there is a catheter inserted into a vein for any one of a variety of clinical reasons. The item gets further broken down into O2 for a peripheral line, O3 for midline, or O4 for central. As you work your way through the item, if your assessment reveals none of the treatments, procedures, or programs apply, then you would code O0110Z1, none of the above. Dash is a valid response for this item. However, CMS expects dash to be used on a rare occurrence. So to summarize, you learned about the organization of Section O for OASIS-E. You also learned about the data sources and the coding instructions for the new assessment item O0110, Special Treatment, Procedures, and Programs. If you have any questions about this presentation, please submit them to pactraining@econometricainc.com by August 31st, 2022. Select questions will be answered in a Q&A session during the September 2022 virtual live event. Thank you.